Welcome to TPMG Health Talk. Join us for valuable insights and practical advice on health topics that matter to you most, delivered by our top medical professionals. At Tidewater Physicians Multi-Specialty Group, we're dedicated to providing high-quality, physician-directed care to the Hampton Roads community. Subscribe now and visit mytpmg.com for more resources. Now let's dive into today's episode. Today, we're thrilled to be joined by Dr. Sarah Chen, a board-certified physician specializing in both internal medicine and pediatrics at TPMG Holland Road Family Medicine in Virginia Beach. Dr. Chen is passionate about building long-term relationships with her patients and emphasizes preventative care to support and maintain good health across their lifespan. Thank you so much for joining us, Dr. Chen.
Thanks for having me.
There's so much we could talk about today. You treat both kids and adults.
Mm-hmm.
Can you tell me more about how family medicine combines care for both groups?
Yeah, I would say that family medicine a lot of times treats adults and kids. Internal medicine is actually, and pediatrics is actually a little bit older than family medicine.
Do you ever find yourself getting parenting tips from patients' families?
Giving parenting tips or getting both, actually. I think it's great. There are so many interesting things that our families bring into us and some cool tricks that they've come up with. I think that the best thing about primary care and medicine in general is that crosstalk, of that ability to help each other out. And I think community is particularly important.
I love that. Well, let's start with something that's always relevant, keeping our families healthy. Cold and flu season, usually linked to the winter months when the weather gets cold, and it feels like everyone around us is getting sick. But here's a common myth. Can you really catch a cold from being outside in cold weather?
No. So your mom was not telling the truth on that one.
My grandma still says it.
Yes. And really, these viruses actually travel better in this colder air, but it's more so to do that during those cold months, we tend to huddle inside together. We're not outside. And if we've learned anything, it's that these indoor compartments were kind of in a small space that's not well ventilated. These viruses pass in an easier way. And so we end up getting sicker during these time periods, mostly because of that, and two, because these viruses like that cold, damp weather.
When it comes to treating cold and flu, especially for the whole family, when should you really start worrying about that scratchy throat or runny nose? And when is it just a, hey, I'll ride this out to the tea and tissues end?
You know, what I tell my families is that I would rather see 100 kids a day who I tell them, it's okay, we're going to ride this out, take some Tylenol, take some Motrin, then miss the kid who's really sick and has, need for antibiotics or needs to be in the hospital or has that peritonsillar abscess that we worry about. So there are times where a sore throat, and I put that in quotations, can be something that can be life-threatening. And so I would want to see a kid who I tell you, we're okay, we're going to ride this out. We just got to keep this kid hydrated 100 times, then miss the kid who I needed to send to the ER for an abscess or those kinds of things. But generally what I tell people is early on in the disease, when you're sick, the first 1 or 2 days, we tend to have mild symptoms. We tend to not feel super sick, but we know it's coming. It's coming. Days 3 through 5 tend to be the worst that we feel. And then by day 6, 7, we're starting to get better. We're turning that corner. Okay. So if we're sick, but we're able to, eat and drink normally, we're able to keep ourselves comfortable with, Tylenol or Motrin. We're able to breathe comfortably. We're not feeling short of breath. Okay. Then I would try some supportive care at home. Okay. But if we get through, we start to turn that corner, we feel like we're getting better, and all of a sudden we're sick again, that would make me worried that you've now developed a secondary bacterial infection. Okay. Or if you or your kid are sick enough that I can't eat, I can't drink, I can't keep anything down, I've got this fever that I can't control, I'm worried. If you're worried, I'm worried. I tell parents, I might have read the textbook, but I haven't read your kid. And so there is a parent's intuition that is there and that you should listen to. And so I try really hard to listen to my parents' intuition. When they tell me something isn't right, I get the hairs on the back of my neck raise. I go, oh gosh, okay. So if you're worried, I want to see you.
You mentioned a peritonsillar abscess earlier. Can you explain a little bit more about what that is?
Yeah, so it's a pretty rare thing that can occur, but you can get a sore throat or a tonsillitis that's affecting one tonsil, but actually what it is a small pocket of pus behind there, and that pocket of pus can grow and grow and grow, and can actually be a pretty life-threatening thing if you don't treat it appropriately. So one of the things when you go into the doctor and they're looking in the back of your throat, we're looking for evidence of that, of whether or not that's there, which is why sometimes I'm like, on your virtual visit, like, can you open wider?
Right.
Yeah. No. And so I would say that good hand washing, keeping yourself hydrated, and, coming to see us if you're worried at all, we want to see you.
Well, let's switch gears to something that people don't think about until it's too late. Hypertension.
Mm-hmm.
Many people don't realize they have high blood pressure until it leads to something more serious. So, Dr. Chen, when you talk to patients about hypertension, what is the biggest misconception they have? And how do you know if you're at risk?
A lot of times people come to me and they say to me, well, I don't have any symptoms. I have high blood pressure, but I don't suffer from it. I don't have any symptoms of my high blood pressure. And how I explain to them is that you don't have symptoms until damage has already been done. So the second most common cause of congestive heart failure here in the United States is uncontrolled high blood pressure. The second most common cause of end-stage renal disease requiring dialysis is hypertension, okay? So how I explain it is that if you look at a marathon runner, those guys who are out there running distance marathons that have great endurance, okay, they have these long, lean, fast, efficient muscles. You compare that to your bodybuilders who are on the stage and they don't have any neck and they've got those big arms. And those guys are not built for endurance. They're not running marathons typically. Any blood pressure over 120 over 80 is like going to the gym and lifting weights for your heart, okay? But your heart beats on average for an adult 60 to 90 times a minute. So if you think about 60 beats a minute and there are 60 minutes in an hour, that's 3,600 reps in an hour. You multiply that by 24 hours in a day and you're at 86,000 reps. And that over time will lead to the heart getting big and getting clunky. We're getting a bodybuilder type heart, okay? But we don't want that. We want a cheetah's heart. We want a lean, fast, efficient machine. And so that remodeling of the heart into this kind of big, clunky muscle is not efficient, and it oftentimes leads to heart failure, okay? And when your blood exits your heart, and we've got this high blood pressure, it puts strain on our organs like our brain and like our kidneys. And so the effects downstream on these organs can be significant. And so by the time you're telling me you have symptoms, my worry is that you've already done damage to one of those organs or to the heart itself. So the biggest myth is that like this isn't something to worry about because I don't feel sick. It's definitely something to worry about and definitely something we want to see you about. And that's why we have your annual physical and we screen you every year for high blood pressure.
Well, what should they do to stay on top of it and avoid any serious health issues down the road?
Well, it's really important to try and prevent it. So there are certain things that we think about as good preventative measures, and cardiovascular exercise is great. So get out there, do something that makes you sweaty for 30 minutes a day. It does not have to be a treadmill. It does not have to be an elliptical. If you like Zumba, go do Zumba. You want to do jazzercise, do jazzercise. Do something that you enjoy that makes you sweaty for 30 minutes a day. Try and avoid things that cause damage to the heart and that we know cause damage to the heart. So avoid smoking cigarettes, avoid vaping, nicotine, those kinds of things raise blood pressure. Avoid diets that are high in salt and high in processed foods. And then come to your doctor for, once a year annual exams where we can screen you for high blood pressure. Especially if it runs in your family, you may need more frequent screening. But again, it's one of those things where prevention is what I preach. Prevent. And by treating high blood pressure, we prevent so many issues in the future.
Absolutely. Now, another condition that often gets misunderstood is eczema. Many people think it's just dry skin, but there's so much more to it. What are some common triggers and how can people manage flare-ups?
Eczema is like one of those diseases that I see so commonly, but it's so hard to treat. So dry skin is a big trigger. So if the skin is dry, if it's not getting enough moisture, that can be a huge trigger for eczema. Anything that smells really good, you probably shouldn't be putting on your skin if you have eczema, because it's usually made with certain fragrances that can really irritate the skin. So I think the baseline to prevention is good hydration, and hydration that is fragrance free, that we're not introducing a bunch of chemicals of fragrance and smelly stuff into our skin. So I tell my parents of kids, especially young kids with eczema, we want to take baths actually less frequently, because the more number of times you wash the skin, the more times it has to get evaporation out of it to dry it. Okay. And so the more dry the skin becomes over time. So with a baby or a young child with eczema, we're only getting them in the bath maybe 2 or 3 times a week. Okay. So nightly baths are probably not a great idea. And then the minute they are out of that bath, they're getting some kind of lotion on their skin. I really like lotions like CeraVe and Cetaphil and those kinds of things, because they don't really have any of those fragrances in them, and they have ceramides in them that tend to rebuild the skin barrier. I tell them to avoid detergents that have lots of smells in them. So we want to get a free and clear kind of detergent. And I recommend to them that they kind of watch. They may see that there are certain things that tend to trigger their kid, and so you try and watch and see like, oh yeah, every time we do that, he gets a rash. So maybe that's what he's kind of reacting to as well. There is not evidence for elimination diets in children with mild to moderate eczema. Because a lot of people worry, is this coming from something that they're eating? And the evidence has shown us that changing up those kids' diet didn't change their eczema, okay? So in severe cases of eczema, certainly we look for an underlying cause in the food, but in mild to moderate cases, we didn't tend to find a lot of evidence for that. So instead, usually it's environmental triggers, we think. It's things out in the environment that other people's skin doesn't react to, but unfortunately your kid's skin goes, oh, danger, and they get all, like, it's all flustered. So prevention and moisturizing. Moisturize 1 to 2 times a day, every single day.
I know we focus on kids, but can you tell my husband that? Like, he doesn't have eczema, but I'm guessing some of the same principles might apply to adults too.
Same for adults. And most adults do get better with time, but not all adults, especially this time of year where everyone's washing their hands. And thank you for washing your hands to prevent getting sick. But like, your hands get all dried out and then they get all those red dots on them. And yeah, it's this time of year, I call it winter skin. It's like a little alligator skin that we're all walking around in at this point.
Now, do you see triggers are in the same in pediatric patients as you do in adults?
A lot of times, yeah. So a lot of times I do see that adults and pediatric patients share triggers. A lot of times for adults, though, they can also identify certain foods that they think sometimes trigger them. But again, that's few and far between. The majority of the cases, it's not like, oh, I eat this and I get this rash. For the majority of adults, it's those fragrances. It's I washed the dishes the other night with whatever soap that triggered my eczema, or I tried a new detergent, or it's winter and I turned my heat on, and every winter I get like this.
Mm-hmm, mm-hmm. So is it more common in the winter then?
Certainly eczema tends to flare a little bit in winter. In my experience, I think because of the dryness, but you can get it year round.
Well, allergies seem to follow us through every season too. What are some common allergens people should be aware of, and how can they better manage allergic reactions?
The allergies in general are a body's hyper response to the immune system overreacting to stimuluses that are pretty benign, okay? So pollen, for instance, okay? A very common environmental trigger for most adults here. Pollen isn't particularly dangerous to our body, but for some people, their body acts as if it's a virus. They act as if it's bacteria. They get this huge immune response, and that's what causes those allergic symptoms. So the runny nose you're getting, the sneezing that you're getting is your body trying to expel a foreign invader. Unfortunately, that foreign invader is like the things that are naturally in the air because it's springtime and we've got all the, the dandelions out and people have planted their tulips and those kinds of things. So those kinds of, we call it hay fever in that sense, those outdoor allergens, tree, pollens, like pet dander can be another common one for people. It's not that these things are particularly dangerous. It's that your body's over responding to them. Your immune system's like, that's a problem and let's take care of it. And so what we try and do is use things like antihistamines, which kind of block that histaminic response. And that histaminic response is that immune response that creates all those nasty symptoms that you don't like getting.
I always feel like when I take an antihistamine, I feel like it doesn't work for me. Do you ever get that?
Yeah, I have a lot of patients who talk about that. And so I tell them that it's probably an important thing to try a couple different ones, right? And so if one particular brand didn't work well for you, try a different brand. And sometimes people need like more localized approach. I mean, if you're having a lot of runny nose and sneezing, then it might make more sense to use a nasal steroid than it does to use something like Claritin or Zyrtec alone, or maybe you need to use them in combination. Some people have bad enough allergies that we start recommending looking into allergy shots. A natural little home remedy you can use is local honey. So if you find bee honey that comes from a local, beekeeper, that has been shown to have some evidence for it, but you have to do it every day.
Oh my,
so it's
every
like
day.
1 to 2 teaspoons every day.
I did not know that. Oh my gosh. I was like, yes, I'm already ahead of her. I'm doing it. And then you said the every day and I'm okay. Well,
yep, every day and for a couple months before you're going to see any kind of big difference. Wow. That's kind of like nature's allergy shot.
Okay. Well, good food for thought, literally. I actually encourage anyone to just get local honey because it's delicious. I know we've covered a lot, but I want to make sure we're touching all the topics that you're passionate about, including vaping. It's becoming more common across all age groups. What are you seeing in your patients in terms of its impact?
Here's what I will tell people is that vaping is actually relatively newer, okay? We didn't really see vaping become more popular until the 2010s kind of thing, and it's become more popular since then. The biggest problem is that the companies that produce these items have been marketing it as if it's safe. They've been telling people like it's safe, it's the healthy alternative to smoking. And that's not really panning out with the evidence. So when we think about smoking a cigarette, we talk about combustion. And combustion is when you heat something you burn it at a really, really high temperature and you create things like carbon monoxide and those kinds of things. And we call those constituents, okay? Vaping is at a lower temperature. And so combustion isn't occurring. And so carbon monoxide is not being made when you vape, okay? But you're still creating volatile organic compounds when you do this. And those volatile organic compounds, or VOCs, are what we think are the cancer-causing things in it, okay? Now, certainly carbon monoxide is not healthy for your lungs. Tar is not healthy for your lungs. And those things kind of happen during combustion with cigarette smoking. But vaping still creates constituents and it still creates volatile organic compounds. And so it does still carry that cancer-causing potential, okay? And so they make this argument that it's safe, but it's not necessarily safe. And unfortunately, we have found that they are mixing things into there and that can cause injury to the lungs. And so we've all seen the stories of the teenagers who are ending up on ventilators after getting this pneumonitis or this inflammation of the lungs from vaping. But here's some good news. As far as smoking and vaping in general, rates are lower amongst graduating kids in high school than it was when me and you graduated from high school. And so we are getting the message out. We're not there yet. We still have kids who are vaping and smoking and using nicotine products, but in general, they're doing it at a lower rate than we did. And so we are having some success. We just have to keep on pushing. And part of that pushing is that the adults in the room saying to these companies that produce this, like, you don't get to lie and say that this is safe. You don't get to tell lies to these kids and tell them there's nothing to worry about. We have to be truthful in how we present our products and restricting the access of teens to these products. We do know that teens who start smoking or start vaping are way more likely to continue using tobacco in their adulthood. It causes changes to their brain. So their brain becomes addicted earlier, faster, and harder than adults who started smoking. And so it worries me when I see them because what we're creating is lifelong smokers.
Yeah.
And we don't want that. It's so bad for your lungs. It's so bad for your respiratory health, but it's also just bad in general, increasing your risk for even things like osteoporosis. And you wouldn't think that.
Yeah.
Like, how does smoking affect my bones? But it does. It increases your risk quite a bit for osteoporosis and osteopenia. it causes increased risk for stroke and dementia and all of these things. And so I try to focus on that. Like, we're increasing our risk over time, and it's changing your brain and your brain chemistry. And that's scary.
I imagine it's even scarier when you're seeing it firsthand in patients that you see often, assuming that your patients.
Yeah. Sometimes I wish I could just say, like, come with me and follow me and let me have you meet a patient of mine who's unfortunately suffered the consequences of these diseases, and like, let them talk to you about how they kind of felt the same invincibility you feel right now, and oftentimes smoking becomes a coping mechanism for stress in our lives. And it becomes this way that you get that dopamine response and you feel better. Okay. And so a lot of times it becomes that. And unfortunately, those habits are really, really hard to break. But if you could see the consequences, if you could see what some of these diseases look like, you would probably turn away sooner. It's hard. I tell people I go into primary care because I really like to develop relationships with my patients and relationships over time. And so it's hard to see bad outcomes for patients, and it's hard to see people who are at that cusp. You're at the fork in the road. We can turn the ship. Like, we can prevent all these things, and trying to kind of convey that to them in a way that they understand and in a way that they accept. And I think that's the art of medicine, is trying to find that balance. I think that the reason why this seems to be an area for me that evokes so much passion in it is that I really don't like it when I think the public is being misled, or I think that people aren't being honest about something. I think that doctors in general and primary care in general, we have this kind of sacred duty to be truth tellers and to kind of tell people the way to keep themselves healthy and about everything that's going on with their bodies. And so I really don't like it when I think that people are being lied to, or they're not getting the full truth. And unfortunately, I think that these companies are sometimes getting away with that. Mm-hmm. I always tell people I can only help you with the information that I have. But the other thing is that I think that medicine is one of those areas where, like, you should not be afraid your doctor's going to judge you. Right? Like, you should have a relationship with your doctor where you feel like you can tell them things and be honest with them, and that you're not going to receive judgment from them for that. And so I never want my patients to feel like I'm sitting there like scolding them. Like I just think that kind of paternalistic view of this is not a really great look. And it doesn't lead to healthier relationships. And so even if you are struggling with vaping, or you are using tobacco products, it's a personal choice that one person makes. It's my job to tell you the risks and benefits of those decisions. And then your job to make those decisions, right? And so it's really important that you have a relationship with your physician where you feel like you can tell them anything, where you can just talk or ask any of your questions, no stupid question, and just feel like you're going to be accepted.
Before we wrap up, is there anything you'd like to share with our listeners about your experience at TPMG, or any key takeaways?
I actually started here about 2 years ago with the company, but Holland Road has been around since 1977. And so we have patients who still come here, who've been coming here from the very first day the clinic opened. And they and their kids come, and their grandkids come to us. And it's this lovely community of patients and families, and our staff. Like, we have staff who've been working here for over 20 years. Dr. Joy Giovantorio, our managing partner here, she's been here for like over 25 years with this company and with this particular clinic. And so that kind of speaks to not only just the longevity of this clinic, but also the culture of it and the culture of TPMG. I think we are trying our best in a very complex healthcare market and complex, world, to try and deliver good quality care to patients and to form bonds and relationships with them over a lifetime. And that is something that's really, really special, and that you don't see a lot of anymore in medicine. It's kind of the reason I got into medicine. And so I wake up and I look at, my list, and I think to myself, I've got a really, really cool job. I've got a really, really good job and I really like it.
Well, we love to have you, and TPMG is so lucky to have you. Thank you for joining us, Dr. Chen. We really appreciate you sharing your expertise with us. And to our listeners, thank you for tuning in to this episode of TPMG Health Talk. Remember, at TPMG, we're committed to supporting you with a team of experienced doctors dedicated to meeting your unique needs. Until next time, visit mytpmg.com for more resources and information, and don't forget to subscribe to TPMG Health Talk. Join us next time for more valuable advice from our trusted medical professionals. Take care.
The information shared on today's podcast is not intended to be medical advice, nor is it meant to replace a professional consultation with a healthcare provider. The opinions expressed in this podcast do not necessarily reflect those of TPMG or its providers and physicians.